Good. All right. Thank you all very much for staying. I know it's been a long week, and staying to the last lectures is sometimes hard. But I'd like to talk to you a little about trimming and shoeing for navicular disease, or kind of the Farrier's perspective. And I wish I could say it's as simple as, you know, one technique, one shoe, one pad, one something. But I don't think it's quite that simple at all. I think the biggest principle to trimming and shoeing horses with navicular disease is just first and foremost just good, proper Farrier or horseshoeing just to start with. And so I think oftentimes, even myself, I'm guilty of this, given the cases we see, the feet we see, the horses we see. It's often easy to forget normal and forget how a horse is supposed to be trimmed and shod, or how they are best trimmed and shod to be as biomechanically efficient as possible. So just to review that, first, before we get into any specific techniques, these goals or these principles should be achieved first and foremost. And I know that sounds really simple, but I really think it's often forgotten. So here we just have a simple foot, nice, well-built, conformed horse. And so again, some of the first principles we would like to achieve would be a somewhat matched heel angle, matched dorsal hoof wall angle. Not saying that you can ever get there on all horses, or that is the absolute most perfect thing. But again, the closer we can get to that, the more we do feel that the horse is biomechanically efficient, or at least spreading the load over bone, soft tissue, and ultimately the horse's hoof capsule. Okay, so the principle, one of the most foundation things of all Farrier would be to achieve a matched hoof pastern axis. So again, with navicular disease and things like that, horses are often don't have a matched hoof pastern axis, or aren't able to maintain a matched hoof pastern axis throughout a shoeing cycle. So again, trimming and shoeing principles, just sound, solid foundation would be to achieve a matched hoof pastern axis. And then again, regardless of the principle, the technique, the length of foot, any of those things, proportions are key. And me, at least personally, feel very, very strongly that the shoe, the horse's base of support, should be centered around the center rotation of the distal interphalangeal joint. Okay, regardless of the specific technique, the shoe type, the length of the toe, any of those things, those proportions should remain the same in my mind. Okay, so again, just looking from the front. Again, we spend a lot of time looking in the medial lateral plane, but I think we should also look at them from the front. Randy talked earlier about, you know, congruent triangles from the side, but they should be there from the front as well, regardless of length. So again, if you were just to draw a plumb line through the center of the fetlock, through the hoof, draw a line at the coronary band and the ground, and then from the center of the fetlock all the way down, you should have two triangles. We should be striving to achieve, you know, a nice big base of support, and ultimately put it under the horse's limb. You know, regardless of rotational or angular deviations, just straight down from the point of the shoulder. Okay, so when viewing them from the back, again, I think we often lose track, and sometimes often go to very, very far extremes. But again, you should have nice, matched, relaxed heel bulbs, and then again from the back should be one nice big bell shape, applying, you know, an appropriate base of support. So again, the day it's put on, the shoe should be slightly larger than the distal margin of the horse's hoof capsule. Okay, and so again, from the bottom, these are all the exact same horse, shod in just a very, very simple manner with an aluminum shoe. Then from the bottom, again, I really think it's all about proportions around the center of rotation, far more than I do length. Okay? So again, having foot in my mind is a good thing. So centering the base of support, or the shoe or the trim around the center of rotation. You know, again, building, you know, Dusty talked yesterday about building boxes or building rectangles within a foot, and this is kind of what we mean. So again, fitting it to where it's half and half in the front, half in the back from the center of rotation. And then again, the point of heel is going straight to where breakover should be or could be in this particular case. Okay, so again, those are all the external references, and I know, you know, today there's any number of hoof mapping protocols and trimming techniques, but again, I think if not all of those are founded within these basic principles. Okay? Sure, there might be slight slight variations, but I think this is just good, solid, foundational principle. Okay, moving on, just to kind of correlate some of that with the internal markers. Again, this line here, I guess, oh no, it doesn't show up. So this line here indicates the center rotation, and again, it's not an exact science. I guarantee I didn't lose any sleep trying to make sure I had that within millimeters of the exact place. Again, all these proportions should be thought of to try to achieve them, not necessarily sit and make yourself go crazy or lose your mind over millimeters. So again, getting close to the center of rotation, and then again the relationship to the end of the apex of the trimmed frog. Okay, so again, it's roughly 3/8 to 1/2 an inch behind the apex of the frog in my mind. Okay, so again, if we were just to move forward, just to kind of review and summarize before we get into specific techniques, just to talk about just the general principles of Farrier as I see them, and what our job would be to remove distortion from the horse's hoof capsule and maintain as healthy a hoof capsule as possible. That's one of our biggest, if not our biggest goal. Okay, and then I think we should make every effort possible to preserve sole depth, keep enough foot on a horse to keep it comfortable in a multitude of terrains over an entire shoeing cycle. Okay, so again, just cutting them crazy short, I don't think is good for them. And I do think that horses should have enough sole depth to stay comfortable through an entire shoeing cycle, including the day, the moment you're done trimming and shoeing them. Okay, so then I think we should try to achieve a matched hoof pastern axis, center the shoe around the center rotation of the distal interphalangeal joint, reduce as many levers or mechanical prying on the hoof capsule and the structures of the distal limb as we possibly can, and then provide an appropriate base of support. And then again, when it comes down to techniques, I know even here in some of the round tables and some of the discussions we have, all the conflict between Farriers and even within the vet Farrier team usually revolves around a specific technique. I like to use 3-degree aluminum egg bars versus the guy that likes to use natural balance shoes and a plastic wedge pad and Equipack. Okay, so again, the specific techniques are what tends to start the battles or the discussions or the conflicts. But if we could all make a point to go out and agree on the principles that we would like to achieve for just normal Farrier, along with the principles we'd like to achieve in treating or managing various disease pathologies or conformational defects, I think we could go a long way to eliminate a lot of the difficulties and conflicts within our own profession, the Farrier profession, and along with the vet Farrier team. So again, the specific technique is not near as important in my mind as is just achieving the principles of treatment or the principles of Farrier. Does everybody agree? Can we all resolve ourselves in 2018 to achieve that and discuss principles rather than techniques? You don't see anybody in a bar fight over, again, the principles. We'd like to make it easy on this horse to move. We'd like to provide an appropriate base of support, but we do find those bar fights over specific techniques. So that would be my ultimate take-home message, and ultimately we're going to use navicular disease and trimming and shoeing horses with issues within the navicular apparatus to discuss some of those options. So just like Dr. Pleasant indicated earlier or showed earlier, radiographs are often used to help guide trimming and shoeing, and I see no problem with that. There's a lot of great value in that. But again, in using radiographs to guide trimming and shoeing, it's just like looking at the picture of the outside of the hoof. So again, the principles are the same from a Farrier standpoint. I think when we're using them to guide trimming and shoeing, sometimes we get lost in our profession trying to look at intimate structures or trying to diagnose different things. But again, that should be the vet profession. Let them deal with that. But as a Farrier profession, I do think that we can use radiographs to, again, guide trimming and shoeing. So you should absolutely be using them to assess, do you or do you not have a matched hoof pastern axis, a rough idea of where the center of rotation of the distal interphalangeal joint is and kind of assess your base of support. Should absolutely be looking at the horse's palmar angle. Is it the palmar angle you'd like to achieve? You know, do we have the appropriate base of support, and is it centered around the center of rotation? So every radiograph you see, I think all of these images should just pop into your mind. All these measurements, and you'll notice that I say measurement, but there's not a single number on any of them. In my mind, you should just be able to draw those lines, look at them, and imagine them in your mind. And the one we didn't talk about is the brown one here, which is the horse's sole depth. And ultimately, I find, you know, sound horses tend to have adequate or more than adequate sole depth. Okay, so that is something that should be preserved, should be maintained. It should great care should be taken to ensure that horses have, you know, sufficient or adequate sole depth to remain comfortable. So again, this is a horse suffering from navicular disease, and we'll just show you kind of what we'd like to achieve with a trimming shoeing plan. So again, if you just throw all those measurements up there real quick, or the lines or the things that should pop out into your mind as you're reviewing these radiographs as a part of a vet farrier team. Now you can see this is more closely associated to what we described as what we would like to achieve, a closer hoof-pastern axis, if not a matched hoof-pastern axis, a slightly positive palmar angle, a shoe that's centered roughly around the center of rotation of the distal interphalangeal joint, and we maintain sole depth. Obviously, there's no way to just dramatically increase it that day, but we can certainly go the opposite way. So we maintain it. Doesn't really matter how I got there specifically, or what that specific shoe is, or what that specific pad is, or what that specific rivet is, or what that specific packing material is there. Those are the principles you'd like to achieve, and I think we should focus on that. So that's one way of getting there. Here's another horse, again, with some of the prototypical specific techniques that are often used for a horse with navicular disease. So again, it's an aluminum shoe with a blunt toe that's rolled real heavy, and the horse has a wedge pad. Okay? But again, those principles we're trying to achieve aren't achieved, even though those are specific techniques that are often utilized within this disease pathology. So again, taking that horse, and again, these lines should pop out in your mind, just looking roughly at the center of rotation. It's nowhere near 50-50. The horse does have adequate, if not more than adequate, sole depth. And then again, post trimming and shoeing, you know, again, we can achieve all those same things. So a roughly matched hoof-pastern axis, center of the shoe around the center of rotation, you know, maintained sole depth, or provided or left adequate sole depth. Okay? And then we ease or reduce break over to allow the horse to facilitate, you know, break over, unroll, turn over, whatever you want to call it, move forward. Okay? And so again, when we talk about maybe some specific things, if we were to just talk about trimming the horse and how we're going to go about providing all those things, this is a very common, you know, hoof or shoe that we see in our area. I think it's shod, you know, fairly well. Of course it's short. That's the big thing we're going to pick on, but there's a lot of good, a lot of pluses, a lot of things there. And so when we get to the bottom of the foot, or specifically talk about how we're going to trim and shoe them, I think, again, providing the horse's base of support and heel trimming, we would like to trim them and pull them back to as an appropriate base of support we can, while specifically maintaining as matched of a hoof-pastern axis as possible. And then we can use other things to ensure that we do get to that base. But I think as you trim and lower heels, pull them back, you should be striving to get closer to the widest point of the frog. Not saying that you need to go all the way to there and then fit your shoe to there. So again, making sure that we trim them. The idea of just stacking heel and leaving a whole lot of heel, you know, may help in the hoof-pastern axis department, but may, you know, hurt yourself in providing an appropriate base of support. Okay, so again, when we come down to specifically trimming and shoeing these horses, or any horse, you have all these, you know, multitude of options out there to consider. Okay, and so again, in my mind, this is just the way it goes start to finish. So the horse has got to be shod for whatever particular reason. In this case, you know, issues with the navicular apparatus. So first question is going to be aluminum versus steel. Next, bar versus open heel, flat versus wedge, and then whatever modifications we want to use. Okay, so if we were to go through them, you know, making the decision between aluminum and steel, I think some of the factors that you should, as a practitioner or as a vet farrier team, should consider would be the weight, the horse's use, the horse's size, how you're going to attach it, meaning nail it versus glue it, and then obviously the horse's discipline, environment, and ultimately the financial constraints or considerations from the owner may play a role. So when you're deciding aluminum steel, it should be a conscious decision, not just, oh, horses with navicular disease should get an aluminum shoe, or oh, horses with navicular disease should get a steel shoe, or whatever. It should be a conscious decision, no matter the horse, the case. It should be a decision in your mind. And then again, when we get off into the bar versus open heel, you know, again, my history, you know, throughout my trimming and shoeing career, I've often been told this horse has navicular disease, we need to put a bar on. Okay, so everybody heard that. That's like the magical shoe that's gonna cure it all, and that would be wonderful. And I do think it helps in a lot of situations. And so when you're trying to decide, you know, bar versus open heel, I think you should assess all of these, or at least consider all of these factors. So again, the horse's use, the environment, the likelihood of shoe loss, and then specifically what kind of bar shoe. So there are any number of bar shoes out there and would be indicated in various different situations, horses, and ultimately disease pathologies. Okay, so while you're also considering the bar versus the open heel question, I would challenge you to ask yourself specifically what does the bar do. So it doesn't just do some magical thing that helps horses. So again, you should make the conscious decision. So in my mind, this is what a bar does. Okay, so it does probably limit independent heel movement of the horse's hoof capsule. It may limit heel sinking and the soft footing to a certain degree. Okay, and then it may, depending on how it's fit, may provide, you know, more support or a longer, fuller, wider fit. Okay, but again, that's all within the hands of the farrier or the person applying or fitting the shoe. So again, here we have two bar shoes, and they're fit in markedly different ways. So again, the bar shoe you see here, again, it's a nice shoeing job, you know, but again, just because it's a bar shoe doesn't mean it provided, you know, a longer, fuller fitting shoe. It can if applied in this manner. And again, I'm not saying that this has to be the way you apply it. This, for, you know, whatever reason, may be the way this one needed to be applied. But again, it's often working with younger vets, and many vets in the profession, they just automatically think a bar shoe will provide, you know, a longer, fuller fitting shoe with a larger base of support. But it's important to understand that all depends on the person applying it. Okay, and then again, you know, we've all ran into practitioners, both vets and farriers, that indicate or state that all horses with navicular disease should have a straight bar shoe or an egg bar shoe, and they should never be trimmed and shod with a heart bar. So again, I would challenge yourself with critical thinking, depending on how the heart bar is fit. Of course, it could cause, you know, pressure and pain to a horse suffering from issues within the navicular apparatus. Pushing straight on to the frog with a positive pressure heart bar may not be the best thing for it. Depending on the heel conformation, you know, a underrun heel with a long sloping pastern that you're trying to get to grow adequate heel, putting some of the load onto the frog may be the best thing for the hoof capsule, but ultimately hurt a horse suffering from bursitis or something like that. But depending on how it's fit, the heart bar could be the ultimate protector to the navicular region as well. So if it never makes contact with the horse's frog, it's just a big metal piece there that is protecting it. So again, I'm not stating that all horses need heart bars or all horses need straight bars or egg bars, but I'm just saying that every time you make the choice to apply, you know, a trimming and shoeing application to a horse, it should be a conscious decision, and you should know why you're doing it, have a valid argument. Okay? And so again, being able to talk about that and discuss that with you know, your vet, farrier, and owner team, being able to defend yourself or describe why you want to do something, I think is very important to ensure you have a relatively happy, healthy vet, farrier, horse owner relationship. Okay? So again, there are other ways to make those protectors from the heart bar. You could make inverted bars like this that protect right over the navicular apparatus. You could weld rasps across there. You could weld heel plates across there. You could do any number of things. So if you decide, that this horse suffering from issues with the navicular apparatus needs something to protect itself from the ground force pushing on it, there's any number of ways to achieve that. Okay. So again, moving on, I think you often get the argument between flat versus wedge shoe versus wedge pad. And again, a lot of those arguments I think would be avoided if you would just simply ask yourself, how do you decide between a flat shoe and a wedge shoe? Okay? And in my mind, they're used when you can't achieve a matched hoof pattern axis with the trim. So you may have to use wedges to achieve that, and then specifically which wedge you use, to me, doesn't really matter. Okay? And then there are, of course, the acute injuries or the lesions within the navicular apparatus where you may use wedges and wedge beyond a matched hoof pattern axis, like a fractured navicular bone, a puncture to the navicular area, a tear or rupture within the deep digital flexor tendon. You may wedge beyond a matched hoof pattern axis, but just on average, everyday shoeing in the chronic cases, you've got to ask yourself specifically, why am I using that wedge? So again, when you think about the wedges, you should think about the effects of the wedges. And so it's easy to think about just their effects on the deep digital flexor tendon or the navicular apparatus, which are generally positive, but you should also consider their effects on the hoof capsule, and what you've noticed and what literature out there indicates. Asking yourself, what does it do to the hoof capsule? Or does it keep a nice, healthy, functioning hoof capsule? Sometimes, but it may have negative effects on it. And so that should be considered. You should consider its effects on the superficial digital flexor tendon, the suspensory ligament, and ultimately the horse's gait. Okay? So again, lots of things to consider when you're using a wedge, not just simply stating a horse with a navicular disease or injuries within the navicular apparatus should be wedged. Okay? So again, you can absolutely modify the heels of a shoe, whether it be a bar shoe, an open-heeled shoe, any of those. You can increase the surface area in the heel region and decrease the surface area in the toe to effectively, in soft footing, supply the horse with a dynamic wedge to limit heel sinking in soft footing. So again, depending on the horse's discipline or how they're going to perform or the environment they're going to train on and work on, this may be an adequate way to achieve the wedging effect that you would like. But depending on what it is, if it's a cart horse and it's on firm footing all the time, you're not going to get your wedge effect. So to get your wedge effect, you may have to use a wedge pad or a wedge shoe to achieve the same effect. So consciously understanding and remembering and choosing which of these to do to achieve your wedging effect. Okay? So again, that's a little bit about the heel modifications, and then with heel modifications, one should consider toe modifications as well. And again, all of them, their purpose is to ease, facilitate, break over, roll over, unrollment, whatever. They're all designed to reduce stress and strain on the navicular apparatus. That's the purpose, that's the thought that behind all of those modifications when you're talking about a horse with specific injuries or issues within the navicular apparatus. Okay? And then again, there are any number of ways to get there. And so I think we'd all be remiss to pick one of these and say that's ours and then want to fight everybody that does anything else there. Okay? So again, all of those modifications can be done and used to achieve the exact same purpose. So what does it really matter which specific technique someone else used to get there? Okay? So then moving on, we often incorporate pads within shoeing a lot of horses, and obviously shoeing horses with navicular issues. Okay? And so again, you've got any number of options out there, from wedge to flat, leather versus plastic, full, bar, rim, frog. And then, obviously a lot of what we're using those for is to recruit the frog and sole into load bearing, and also to provide, cushion within the back half of the foot. And we may use them to provide artificial sole depth in the front half of the of the foot. But again, that's their purpose. They're not just some magical thing. So if you have a specific purpose for them, obviously I'm a big fan of pads, and then we'll move through specifically how to apply or use some of them. And so again, I can't stop myself from being the Farrier and want to show you some little tip or trick that I learned throughout my career. And so, obviously most shoes that I put on have clips, and ultimately basically every shoe I put on that has a pad has a clip. And so getting around the clips is often difficult in fitting a pad. And so by just simply placing it into a grinder with a stone wheel, I think it's very easy to achieve a nice clip fit within them, and then cut it, remove it, grind it, do whatever you normally do. But I think this little grinding wheel and grinding right through there, and just until you see the first couple of sparks, make it very easy to get a nice clip fit in with the pad. Okay. And then again, all pads, wedged or flat, mean that you're adding length, you're adding width, you should be adding expansion. So again, if our principle is to achieve a nice big bell shape when looking from the back half, as you add length with a pad or as you add length with a wedge, you also have to add width. Everything should be getting bigger as it goes down, not just getting bigger, and then straight, or worse yet, coming under. So again, providing a nice big base of support. So when viewing from the back, this is personally what I think a foot should look like that's been fit with a pad, or ultimately in this case, a wedge pad. Okay. And then again, to achieve the principle of providing frog and sole support or cushion in the back half of the foot, just putting on a pad doesn't do it. So you have to incorporate some sort of packing material. And then again, I would encourage you, or all Farriers or all practitioners, to understand a multitude of different packing materials. Okay, so again, there are going to be cases where one is better than the other, and I do think it is the Farrier's job to familiarize themselves with as many different techniques and different products and materials that are out there. So when you're presented with a case with a horse owner, the horse and the vet, you're very well suited to achieve whatever principles or desired effects are needed. So again, a quick little thing. Again, most of us, we kind of know all of these products, and I'll go through them one at a time. But again, one that I think is often missed is silicone, betadine, and copper sulfate. And so again, this isn't my mixture, my thing. It's something I got from somebody else and often utilized. But window silicone is a nice, cheap packing material that is very soft and very forgiving. Okay, and so we add the copper sulfate to be a long-term antimicrobial, and then the betadine to act as a catalyst to set it up. So again, that would be the ratio that I would use. It's not very scientific, just a few drops of betadine, a scoop full of copper sulfate, and half a cup full of silicone. Stir it up, mix it up with a tongue depressor, and then for me, I start in one heel or the one sulcus of the frog, press down and go all the way through, just to make one smooth bottom. Okay, so and then simply just nail a shoe and a pad on there, and then when you come back 6 weeks later, this is what it looks like. So this is simply just the shoe removed. Okay, so the packing's still sitting there. This is what the solar surface looks like, roughly untouched, picked out slightly. You can see, it does breach a little bit, so you do get a little bit of dirt and debris against the sole. Brush it away. You can see the nice green tint to it, so that's indicative of that the copper sulfate is doing its job. It is leaching into the hoof capsule. That's a pretty happy, healthy frog and sole, free of dirt, debris, and all the opportunistic microbes or the disease pathologies that are often associated with the use of pads, like exacerbating white line disease or causing thrush. So incorporating the copper sulfate limits that, or essentially just eliminates those fears. Okay? So again, moving on from that packing material, VetTech and EquiPack, obviously they have a multitude of options for us. They're great products, but it is important for you to know that each one of them is a different density, and you should consider that when applying them to the foot. Okay? So you should consciously decide, do I need soft, do I need in the middle, or do I need really, really hard? And ultimately, some of that may be trial and error on the case, or depending on the case. Put it on and see how the horse reacts. Okay? But I would strongly advocate the use of copper sulfate against the foot, regardless of which one of those packing materials you use, the silicone or the Equipacks. I would still put copper sulfate against the horse's hoof and then fill it with one of those urethanes. Okay? And so again, moving on from the urethanes or the Equipacks, you can get as creative as you want with them. So again, horses that need a little bit of extra traction but also need the frog and sole support, you can tip it down to where your inner edge is still exposed at the toe. Horse should have plenty of traction there, which seems a little counterintuitive with stud holes, the toe, and a plain stamped shoe. But if traction is a concern, you can absolutely tip it down. Okay. And then even in tipping that down, you may also achieve some of your desired effects, such as increasing surface area in the back half of the foot and decreasing surface area in the front, so you have a rough dynamic wedge in soft footing. Okay. So again, other ways to do it or go about it be using flat pads, and then again, depending on the horse, you may want to use different pad or packing material. So this particular one has frog and sole support in the back half and a different packing material in the toe. Okay? And then it also has, a big heel plate. So again, increasing surface area in the back half of the foot, which may or may not create one of those dynamic wedges, but it may counteract the big, broad or blunt toe shape we have here. So again, there are some people that have concerns of putting shoes like this that have the big, blunt, broad toes to facilitate or ease breakover, because it is markedly wider than this. And so just putting that on may go the opposite way and create a reverse wedge. But by using a frog pad or a bar or a heel plate with Equipack, you can hopefully negate the effects of that section difference. Okay? Okay. And then again, some navicular horses simply don't like pressure over the navicular apparatus, but they still want something there to protect themselves from ground force. So again, a full pour like this may be too much for some of those. So if it is, a nice, easy way to eliminate or limit that would be to still use the Equipack and basically create a recess or a ledge away from the frog area, and that's done simply by taking the foam boards, cutting out a frog piece, and sticking that frog piece against the hoof and squirting in the Equipack. So when you're done, you end up with an area like this where you have thin coverage over it, but it's not full load or full pressure. So sometimes in cases, that little bit of difference makes a lot of difference in the comfort or the soundness of that horse. Okay? So again, then another trick that is often utilized in these horses to, again, have something soft against the foot but protected from the ground itself would be what a lot of people refer to as a combination pour. So squirting in one material first, whether it be Equipack Soft or normal Equipack or whatever, and then filling it with SoleGuard or a firmer or harder urethane. So again, you have something soft against the foot and something hard against the ground, hopefully to limit some of that force. Okay? So again, even if you want to move into products that have other densities available to them, the impression materials or the silicones that are out there, from Nanrick to Sound Horse to Grand Sur, any number of those out there can be utilized, and they all have different densities. And so you should make yourself familiar with all of those products, so you will know, or at least have the ability to select one when you're trying to use them in a case that may like something soft or may like something much more firm. And so they're easy to use. They absolutely can be mixed with copper sulfate, and I would strongly encourage you to do so. So you can just take equal parts of the impression material, whichever one you choose, mix them together, and then put them in the foot. Okay, and so they can be under pads, under heel plates, under anything. They just do not stick to the horse's foot like the urethanes do. So something has to hold them in there. So a heart, a heel plate, a pad, something. Okay, and so again, I think all of those and those principles are what should be accomplished to treat the classic navicular disease or injuries within the navicular apparatus. Okay, and then so moving on from them, obviously Dr. Pleasant talked to you a lot about diagnosis and of injuries or problems within the navicular apparatus, but it's often difficult, and so one that is often clinically presented, but sometimes without a specific diagnosis, gets lumped into navicular disease or problems with the navicular apparatus, would be issues or lesions within the collateral ligaments of the distal interphalangeal joint. So again, I know it's not classic navicular disease, and I know it's not really a structure that's associated with the navicular apparatus, but it is often presented in a similar way or difficult to diagnose without the use of advanced diagnostics like the MRI. So just talking about trimming and shoeing horses with injuries to the collateral ligament, this is something that's very popular nowadays, or using again these ground force reaction shoes that have wider branches on a side with again, I know I heard the argument here at this event, which side should the wide side go under? It's my personal belief to limit stress and strain on that area from tension would be by putting the wider branch under the injured collateral ligament. Okay, and so again, when the horse is in soft footing, it should have a tendency to want to float a little on that side and sink on the other. So you can do everything from hand make it to grind something in a normal shoe. And again, just like we were talking about front and hind, it's just changing the section or just changing the surface area. So it can be done by grinding, fullering, cutting, widening one side, adding to the other side, welding, hand making, doing whatever you want to do. So keg shoes can be modified. You can buy shoes, from ACR or Grand Circuit. You can do any number of things. But again, the principle you're trying to achieve would be to put, again, the wider branch under the injured area to limit sinking on that side in soft footing. Okay. So any questions on any of that? Anybody? Nothing? All right. Well, then we'll go through a couple cases really quick to kind of show you or talk about or highlight, again, the principles you would like to achieve, and then show you some of the specific techniques that were utilized. So case number one, we've got a 16-year-old warm blood gelding, presents for an evaluation of a forelimb lameness. The history indicates an insidious onset of forelimb issues, and the horse is now lame. Physical examination reveals a broken back hoof pastern axis and underrun heel conformation on the left front and right front. This horse resents hoof tester pressure over the navicular region on the left front and the right front, more so on the left front. Lameness examination reveals a 1 out of 5 left front lameness when trotted in hand in a straight line on an asphalt or hard surface, and a grade 2 to 3 left front lameness when trotted to the left on a lunge line on the asphalt surface. So again, the left front lameness was resolved with a palmar digital nerve block. The horse then demonstrated a grade 2 of 5 right front lameness when trotted to the right. Okay. So again, ancillary diagnostics, radiographic examination of the left front and the right front foot. So here's a 0-degree lateral to medial radiograph, centered at the distal margin of the distal phalanx and the widest point of the horse's foot. So again, we can all look at that. And as I roll through this is my ideal information or hopefully what should be coming to the farrier from the veterinarian. I'm in no way saying that me personally should or was out there performing these examinations, but this should be the information. This is what they're bringing to the team for sure. Okay, so information from these radiographs. Hopefully, again, depending on a lot of the lectures you saw here today, you can see all of the changes within the navicular bone, changes within the distal interphalangeal joint. This is the flexor skyline view again. So here you can see the navicular bone. This is a 65-degree DP. Navicular bone's hiding right here. So now we have all this information. And so if we were to develop a thought and a plan. So again, getting all that information, and then now's the time to come up with a specific plan. So anybody want to scream out a specific plan? What you would do? Nobody? Okay, yeah, no, so the statement is you're dealing with some low ring bone in there as well. So of course, in this particular horse, yes, there's degenerative joint disease of the distal interphalangeal joint associated with this case. There are problems with the navicular apparatus associated with this case. Who's whistling? Just scream something out. Well, I can't see anybody. Yep. Okay, so concussion may exacerbate this. Obviously, this horse, that lameness exam is done on hard footing, just like Dr. Pleasant indicated. That does increase concussion or shock to the distal limb, the horse's hoof capsule. Again, hopefully by now we've all. Yep, you want to shout something? Okay. Mm-hmm.
So would that lead you to think that it's more like the ligaments, the collateral ligaments, than the actual like bone change of itself? Could that kind of lead towards that?
Yeah. Yep. So the statement is lunging or turning the horse on this hard footing does apply a lot of torque to that area. So the question is, do we think it could be ligamentous involvement or those collateral ligaments of the distal interphalangeal joint? Could they be the problem more so than the bony changes or the things we see on the radiograph? And I think that's absolutely a very, very valid question and a very valid concern, and likely that answer can't come without an MRI, which is exactly why I put those little statements in here and those anatomical structures and those shoes, because that injuries to that area often fall into this group or often presented to the Farriers. So again, out of this, it's very difficult to get an extremely specific diagnosis without advanced imaging. So again, we don't know. So if we were to develop a trimming, shoeing, or a treatment plan, again, just focusing on the principles we would hope would help in all of those cases. An extension, in case number 3, if we make it that far, you'll see an extension. Yep. So again, the therapeutic plan for this particular case would be to institute medical therapies to help retard the degenerative process within the coffin joint and the navicular apparatus, which again is the vet role. That's their half of the team. And then we're also going to work as a team to develop a trimming and shoeing plan to again focus on simply reducing the stress and strain on the coffin joint and the navicular region. So again, we put some things in here. Obviously, I'm not here to talk to you about corticosteroids or the bisphosphonates, but just they're putting there just to highlight there is another member of this team. There is a vet that is trying to help within this degenerative process as well. So again, when we look at the radiograph of how this particular horse is trimmed and shod, some of our things are achieved. We've got a relatively matched hoof pastern axis. We have a slightly positive palmar angle. If we were to really pick on this hard, the biggest thing that I would see, or the biggest principle that wasn't achieved from that big list we gave earlier, was just simply the base of support. And it's not centered around the center of rotation of the distal interphalangeal joint. So again, a simple alteration in the trimming and shoeing plan, then use the radiographs to confirm or assess what you did. So simply by providing a longer, fuller fitting shoe, set back slightly with a rolled toe, now we've got what I personally believe is an appropriate base of support. So it's centered around the center of rotation. We kept what little sole depth this particular horse has, and then also recruited a frog and sole into load bearing, and also to provide artificial sole depth and protection or hopefully some shock reduction to the back half of the foot. But obviously this is the very specific case where you've got to ask yourself specifically what kind of density, what kind of packing material can you use in this particular case. But again, those same principles could have been achieved any number of ways. So again, that should hopefully be the take-home message. Okay? So moving on, case number 2 would be a 10-year-old warm blood gelding with a history of left front lameness after tossing the rider and galloping through the showgrounds. Lameness resolved after 2 weeks of rest, but returned shortly after work was resumed. Physical exam, a broken back, hoof pastern access, underrun heel conformation. The hoof tester examination was within normal limits. There was a grade 3 of 5 left front lameness when trotted hand in a straight line, again on a hard surface. The left front lameness resolved with a palmar digital nerve block, but did not switch. So again, that would be what Dr. Pleasant described earlier as, a presentation of a non-classical form of navicular disease. So this is obviously more of the acute injury, and so the history and the lameness examination kind of give you that idea. Radiographs of the left front foot, again looking at the lateral medial radiograph. You should again assess all of those things: sole depth, base of support, hoof pastern access, all those things. So obviously a lot of our principles that we'd like to achieve aren't achieved here yet. So again, moving on, that's the one to guide trimming and shoeing. A radiograph up closer, focused on the coffin joint itself for the navicular bone. Okay. Moving forward, a DP to kind of assess medial lateral balance. 65-degree DP to assess the health of the navicular bone, which again, I know we're moving quick, but in this case looks good, fairly relatively healthy looking navicular bone. The skyline view, again, assessing the health of the navicular bone. In this case, we're just going to go that our vet told us it looks great. Everything is good to go there. So what should the thought or plan be? Again. Yep. 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 Yeah. So the question is, in a case like this, what would be the trimming and shoeing protocol? And again, I would say that this is the case or the type of case that is often very frustrating to the Farrier half of a vet Farrier team to come with just that little bit of information. And I know that it's often dictated by the resources that are available of the clinic, the veterinarian, and ultimately the owner's finances. But this is that case that does lead to a lot of discussion or a lot of conflict because it's just dumped in your lap and said to fix it. Okay, and so luckily, and again, and I would encourage you in those cases, to just try to achieve all of those principles. Just do the best shoeing job you can to help all of those areas, and then again in those cases, that may be what has to happen, and see if it works or not. Okay, but if you have the opportunity, advanced diagnostics make life a lot easier. So as a Farrier, working as a part of a vet Farrier team, life is a lot easier and a lot more effective if you have a very specific diagnosis from the vet team. But often that is difficult as well, and it's easy for us or me to jump up and down and want to yell at them and say, oh well, without a specific diagnosis, I can't do anything, or it's a problem on your side. But again, they're often limited by the resources and the owner themselves. So just like when they jump up and down and yell at us for not having a longer, fuller fitting shoe, and we're doing it because the horse lives out on 1,000 acres with a creek in the pasture, and all these problems, it's done for a reason. So just like I don't want to be yelled at for that, I don't think we should yell or complain too much when they don't have as specific diagnosis as possible. As long as they're coming with information and a suspected diagnosis or at least some principles they'd like to achieve to help this horse, then I think we should try to develop a plan to do so. So this specific horse has an injury to the medial lobe of the deep digital flexor tendon, confirmed with an MRI, which is great. But the main thing is in the history and the clinical presentation. So the fact that it didn't switch and it has a history of something like an acute lameness. So again, Dr. Pleasant talked earlier, classic navicular disease is an insidious onset, and most of the time, almost always is bilateral. So it may present as a one limb lameness, and then when diagnostic analgesia is used, they often switch, or another lameness becomes apparent on the opposite limb that also resolves with a palmar digital nerve block. So again, these are two very different cases, and the only really way to know that is with the history and the the physical examination and the diagnostics performed by the vet team. Okay, so again, now that we know that, what would the thoughts or plans be? So again, in this specific case, I would tell you basically it's all those same things again. So here we have our radiograph with all of our lines on it. So a broken back, hoof pastern axis, you know, a base of support that is not centered around the center rotation, a flat palmar angle, and again, insufficient sole depth. So post-trimming, trimming and shoeing, we again maintained the sole depth that we had, achieved a more matched hoof pastern axis, provided an appropriate base of support, and used a wedged pad to incorporate a slightly positive palmar angle. But again, an acute lesion to the deep digital flexor tendon, these are the cases where you may wedge even beyond a matched hoof pastern axis. So again, we may put this on, see how it goes. If it's not enough, wedge more next time. But in this case, we were concerned, did utilize, you know, the wedge pad to achieve a roughly matched hoof pastern axis, and then also made a giant heel plate out of Equipack. So if it goes into soft footing, it would be even more of a wedge, or at least hopefully limit any heel sinking that would cause the horse to go in a reverse direction. And then obviously the vet team did other things, and we as farriers like to focus on the trimming and shoeing plan, but knowing that they provide a lot as well. So they have medical therapies, and then in this case they're also using shockwave to that area, and then they have a very specific rest and rehabilitation program. Not that I'm going to go through that with you guys, but I think as farriers and a part of a vet farrier team, we often forget that they are providing and doing a lot in the case as well, and ultimately owner compliance to all of this is going to indicate or dictate the outcome for the horse. Okay, and so we'll just move through one more quickly just so we can talk a little bit about the extension. So now we have a 14-year-old warm blood used for dressage, presents with a right front lameness. It's worse on a small circle on hard ground. The horse is built with a moderate right front fetlock varus. This horse improves with a palmar digital nerve block and is sound with an abaxial sesamoid nerve block, and radiographs of the foot are within normal limits. And so again, what would you do, or what would be the thought and the plan in that case? We'll move on. This one actually did have an MRI that revealed an injury to the collateral ligament itself, and so very specifically the lateral collateral ligament of the distal interphalangeal joint. And so at that point, you should again be thinking, coming up with a plan. And it's easy, you know, collateral ligament injury, immediately the first thing that pops in our mind is the wide branch to limit sinking on that side. But again, the horse's conformation and the fact that it is right front fetlock varus also dictates that we may want to have something extending beyond the perimeter of the hoof capsule on that side as well. So that is likely what predisposes this horse to injuring that area. So not only would it have, you know, again, a wider branch under the hoof, but also outside of the hoof. So again, when we're looking at it from the back, again, just using those lines we saw on the very first couple of slides just to provide an appropriate base of support. And it's often discussed and described in a mediolateral plane, but it should also be the same when viewed in a dorsal, or in this case, a palmar dorsal plane. So again, it looks extreme, but if you stand and look at the horse, it's just simply filling in that missing bell, that missing base of support. So when you see it from the bottom, it has a wider branch, a more narrow branch, extension beyond the outer perimeter of the hoof capsule, and a wider branch under the hoof capsule. So again, those are the cases with those conformational defects that I would use an extension as well. If the horse has a normal conformation and an injured, you know, collateral ligament, those would be the ones to have just the wider branch strictly under the foot, not on the outside perimeter of the horse's hoof. Okay? And so again, in that case, just to highlight it, there's also, again, other veterinary treatments and measurements being done to help or assist in this case. So that is the last case I have for you. Do you guys have any questions? Yes, sir. Mm-hmm. Lee, I'll admit, I'm sorry, I missed half of that. Can you just scream a little louder?
So what I'm asking is, just you asked that we need to weigh our options more.
Mm-hmm.
You're talking about aluminum or steel. So on a thicker section, did you see any benefits of using that thicker section creates on an offset opposed to aluminum, or did you see any that way at all?
Yeah, so I think some of the questions are in that aluminum steel is using aluminum to get a thicker section without an increase in weight. Is that a consideration? Is that kind of what you're asking?
A little bit, but I'm wondering if weight was ever, was that ever?
I mean, again, well, I have to throw it in there because there's all sorts of Farriers in here. But for me personally, I tell you, I don't really worry about weight. But again, I don't shoe, a whole lot of really high level hunters or Western pleasure horses or all these disciplines that typically discuss needing, a reduction in weight. I guess the times that maybe it has come into concern for me would be we all know or at least think the thicker the section is, the more you can alter, hoof mechanics or distal limb mechanics, all centered around breakover or easing or reducing levers around the horse's hoof, right? So the thicker it is, the more angle you can put into it, the more you can come under the horse's hoof capsule, the more you can make it easier for them to go in the opposite direction, or in any direction, I guess I should say. And so when you start getting into needing really thick things to achieve those principles, I do think weight in those cases would probably become a concern. Does that kind of answer the question? All right. Yes, sir, in the back.
The response that you have on your last case there, that with the wide web you were loading more on the medial side when he lands. Does that affect him any?
So in the question is, I think by utilizing this in the extension, when this horse lands, what are the effects? And yes, this will encourage the horse to land slightly lateral first in all different footings, and yes, that may be a concern for you, but without forcing it to land that way. This horse with this conformation lands that way regardless, but without having that lever. In this case, we're adding a lever to it to reduce the likelihood of it twisting or rolling or snapping this way, which is what would hurt the collateral ligament. So this horse, I mean, again, obviously, you guys don't know, you didn't see it. It's a great outcome. The horse loved it all. But again, I think in all actuality, yes, it did help this horse. It did provide comfort to this horse. But it does obviously change how they move. And so even in this extension, again, it's gradually starting from the toe and then becomes very large in the back. And again, playing with that some, depending on how much you put out here, you could create a lever in the wrong plane. You could create a lever on where it breaks over. So horses that are built like this want to break over their lateral toe, and if you put an extension there, you're increasing a force onto that collateral ligament and can actually hurt them. But you, from the widest point back or second nail hole or wherever you look at it and decide you want it to start, that's where you need to start to create a lever to reduce the likelihood of it turning or twisting. Okay? So again, very conscious in where all these things are placed, not just every lateral extension starts at the first nail hole and comes out and is 3/16 of an inch and has a nice hard stop. It should all be dependent on severity or the description of the conformational defect. So. Jeff, is that all we got? Yes. All right. Thank you guys very much.